Newborn screening is a routine part of care for babies in the United States and takes place shortly after birth. These tests help find rare but serious conditions early, often before a baby shows any signs of illness. It is one of the most effective public health programs in the country because early answers can make a life-changing difference. CDC supports states in delivering this screening by helping ensure testing is accurate, reliable, and ready for the future. Today I'll give you a quick look at how CDC's laboratory supports this work. This video uses computer-generated voiceovers. The script was developed with the assistance of Microsoft Copilot, and images on slides 3, 8, and 10 were generated using HHS ChatGPT 5.2. Every state in the United States has a public health program that screens babies for many serious conditions. Shortly after a baby is born, a health professional takes a few drops of blood from the baby's heel and places it on a newborn screening filter paper card. This dried blood sample is sent to the state's newborn screening laboratory for analysis. When a condition is found early, families and doctors can act quickly. Without early detection, the consequences for these babies and their families can be serious. State health departments run the program and partner with CDC for scientific and technical support. Our role at CDC is to help states have confidence in their test results so babies get the care they need as soon as possible. Behind the scenes, state labs test the dried blood spots collected from newborns. To make sure their testing systems stay accurate, they need special quality check materials. These are blood spots made with known levels of specific chemical markers that look like the various conditions that states screen for. States use these spots to confirm that their systems are working correctly, to meet certification requirements, and to help ensure accurate results for every newborn. Here at CDC, we operate the only laboratory in the world that produces these materials at the scale needed to support all U.S. newborn screening programs. We produce about 1 million blood spots each year and provide them to states as part of our public health mission to help states and families. We provide training in laboratory methods, including hands-on experience with specialized techniques and equipment. We also support staff from across the country in strengthening their skills in troubleshooting and interpreting results. Over the past 10 years, nearly every state with a newborn screening laboratory has already participated in training at CDC. Accurate testing depends on well-trained people as much as good equipment. State labs may need to bring on new staff, while the science behind screening continues to advance and grow more complex. That's why many states choose to send their staff to CDC or request a visit from CDC scientists for hands-on training. These skills go beyond what can be learned from a manual or watching a video. They are strengthened through hands-on practice with experienced CDC scientists. Some conditions are especially difficult to detect with current screening methods. For example, earlier ways for detecting a condition called homocystinuria did not always identify every affected newborn. CDC scientists worked with families affected by homocystinuria and with state programs to develop an improved method that increases accuracy and helps identify more babies with the condition. We are supporting states as they evaluate and incorporate this new approach into their screening programs. We also work on ways for states to test for more conditions at once, often saving them time and resources. Together, these efforts help states stay up to date with advances in science, so more babies are identified early and get the care they need. Sometimes a newborn screening program needs extra support, for example, when it is growing quickly, bringing on new staff, or adopting new technology. When that happens, CDC partners closely with states. We work side by side with states to help build skills, improve testing methods, and make lab processes more efficient. These partnerships help programs grow stronger and more confident and often put them in a position to support others as well. We also provide data tools designed specifically for state newborn screening programs. These tools help states bring together data from screening tests so they can better interpret results, spot patterns, and assess disease risk, especially for rare conditions. Everything you've seen today supports one simple goal: helping every state protect its newborns with accurate, timely, and reliable screening. States lead this work, and CDC provides tools, training, and scientific support that help keep the system strong. Together, we help make sure every baby gets the healthiest start possible. States plus CDC equals healthier babies and happier families. The findings and conclusions in this report are those of the authors and do not necessarily represent the official position of the Centers for Disease Control and Prevention. Use of trade names and commercial sources is for identification only and does not constitute endorsement by the U.S. Department of Health and Human Services or the U.S. Centers for Disease Control and Prevention Division of Laboratory Sciences. Photographs used in this presentation are sourced as CDC or are stock images used with permission.